اچھا جی، آج ہم ایک ہمارے ڈائلیسس پیشنٹ ہیں، کافی عرصے سے ڈائلیسس کروا رہے ہیں. ان سے ہم تھوڑی سی ڈائلیسس کے معاملے میں باتیں پوچھیں گے کہ ایک پیشنٹ کو ڈائلیسس پہ آتے ہوئے کن چیلنجز کا سامنا کرنا پڑتا ہے اور کیا چیزیں ہیں جو ان کو مشکلات فیس کرنی پڑتی ہیں، یا ان کا اوورآل ایکسپیرئنس کیا ہے. اور جو نئے آنے والے پیشنٹ ہیں ان کو پہلے سے کیا پریپریشن کر کے رکھنی پڑیں گی کہ وہ ان چیزوں کا سامنا نہ کریں یا کم سے کم مشکلات کے ساتھ اپنا ڈائلیسس کروائیں، جو لوگ ڈائلیسس پہ آ رہے ہیں یا جنہوں نے فیوچر میں آنا ہے. تو رینڈملی ہم کچھ کوشچن کریں گے. یہ ہمارے بڑے پڑھے لکھے جو ہے نا وہ پیشنٹ ہیں اور ان سے ہم تھوڑی سی بات کریں گے. تو یہ مدبر صاحب ہیں، یہ ہمارے پاس کوئی 1 سال سے آ رہے ہیں. ول یو ڈسکرائب کہ آپ کا اوور آل ایکسپیرئنس ڈائلیسس کے معاملے میں کیسا رہا ہے؟
Yes, I would definitely would like to describe since the start.
ٹھیک ہے.
I was diagnosed with nephrotic syndrome since at 1998. So after that, I was getting getting medicines and everything was smooth. But the main problem is that, like in this age, we have so many good things like internet and very informative videos like on your channel. These things were not available. And the other problem was that my nephrologist, he was very senior most nephrologist at that time, but he never discussed the details that while I am having this disease, nephrotic syndrome, I might go to dialysis and these kind of things. He never mentioned those things. So the main problem occurs is that whoever having CKD disease or nephrotic syndrome or this kind of disease, they should have maximum information that how can they slow down the process of getting towards the dialysis process. But when I was first told by the nephrologist that I have to have my dialysis, I was so tense. It was like that sentence for me. I mean, because I have no information about dialysis, but general conception was that if you have dialysis, you're gonna die. So I can remember it was almost a day and night. I was crying, my wife was crying, and we were so tense. And doctor, even at that time, he didn't say anything to us to console us or to make us feel better. So, but when I started having dialysis, I felt that it is not something that you should be afraid of. It is a life-saving process instead. Like if you don't go for it sooner, in fact, my nephrologist waited almost for a year time, even though my creatinine level was 10 at that time, for almost a year. But somehow he kept me on keto diet, and he tried different thing. Maybe I'm not sure that what they were trying to achieve.
His best.
Yeah.
Okay, will you tell us that your daily experience, as you are coming from many years, your daily experience of hemodialysis, what you think that it is good for you, and also told us that you have gone for the renal transplant also.
Yeah. Last year I had my renal transplant, but that wasn't successful. It just lasts for almost only for 17 days. But as far as hemodialysis is concerned, like hemodialysis is something you should go for when there are symptoms. First thing is that your nephrologist should be uh, eligible enough to make the decision that you should go for dialysis sooner. Because if you wait, you get weaker and weaker time to time. Because almost for a year, I never even had egg white for whole 1 year period of time. When you have, or you are not having any kind of protein, no lentils, no meat, nothing. It was like my body was like so skinny. I was almost on 42 kg. But when I got on hemodialysis, I felt better from day one. Before having dialysis, I was vomiting and nausea and bad feelings overall.
It means you have a good experience with the hemodialysis as soon as it was started. Okay. Tell me that you are coming from many years. So, what challenges you daily faced for coming to the hemodialysis center. It is far beyond from your home. Could you share some experiences, some challenges with us?
Yeah, I mean the initial dialysis I had in Gulbarg, which was almost 26 kilometer away from my home.
Okay.
But the best thing was that the nephrologist available there, he always motivated me. Like this is not end of the life. This is start of a new life. And I met a technician there who was having dialysis since almost 30 years, and he was doing 3 jobs at the same time. So when I met him, I asked so many questions that I'm having dialysis. Will I survive? What should I do? What should I eat? How should be my routine? So when he told me that you should feel normal, luckily I was doing that I am a freelancer, so I have to do all the work at home. And the second thing he asked me to do that you should do some exercises. Like almost walk in the morning at about 1.5 hour, and same in the evening. I mean, so that and main thing is the intake. If your intake is good, you are getting good protein, quality protein. You
So what? How could you manage your fluid and diet intake? Because the patient coming hemodialysis, the basic concern from doctor, from their own point of view, that we are facing that problem, that what should we eat and what should we don't. So how could you manage these things, fluid intake and food?
Yeah, the first thing which come to mind, many patients feel the problem that liquid intake. The main issue is that when they take so much salt or so much salt in their diet, they face this kind of issue that they feel thirst all the time, like they are eager to drink something. But the main thing is, if it is something psychology. Patients feels that they are thirsty all the time. Initially, first 6 months, I was having the same feeling. But when I understand the procedure, then I thought that it is not my body is asking for some fluid. It is in my mind only that I am thirsty. So since then, I just control my liquid intake, and after that, I was feeling so much better, because if you drink so much liquid, you can't eat much, because it will capture all your belly and all over the area, and it won't occupy so much space in your stomach. So
Okay, tell me, Mudabbir Saab, that you have experienced any emotional stress after starting this. You have emotional stress definitely when someone breaks a news that you should go for the hemodialysis. This is a basically an emotional stress, emotional breakdown. But after starting hemodialysis, could you experience that if at any time you feel depressed, anxious, that this procedure is going on and going on?
yeah, definitely. But when I was having dialysis, the one question come to every dialysis patient mind: will this last forever? So this question, whenever you ask to anyone, they will say definitely you have to have it rest of your life. And when that things come to mind, patient gets so much panicked, and I was having same feeling. So for almost 3 to 6 month of period of time, I have to use antidepressant as well.
Okay.
But after I used the antidepressant, I felt better. It was not like my mind was
So you are using now?
not now. I used almost 2 years ago for 6 month periods only. Even I have negative thoughts like I should kill myself and things like that, because this is so much. It is getting worse and worse.
Okay, okay. Your family and your friends are very much supportive for your disease is going on and your dialysis are going on. Are they are very supportive, less supportive, and what are the behavior of your community about yourself that you are on the hemodialysis?
Yeah, Alhamdulillah, my wife, my whole family, and everyone supported me a lot. I mean, they are still supporting me. So since I started having dialysis, my whole family is with me. So I was having moral support and whatever they could have done for me. So this is a big plus, especially your life partners plays a very important role. If you are on dialysis and if she stays strong, you feel good. And I have only one kid, he's almost 10 11 years old. So it was very important that she should have strong nerves to support me and child at the same time, because for 6 months my body was not getting addicted to this thing like dialysis. I was, whenever I had dialysis, I start vomiting and things like that, and my blood pressure shoots up and I had severe headache. Due to headache I feel like vomit. So but at that period of time, my son and my wife, they both supported me a lot. So
We have taken your a lot of time. Thank you. But last two questions. Could you express your feeling or your experiences with the healthcare team providing you the hemodialysis? Are they are very good? They are supportive. They have a good conversation with you. This always supports you. And the patient coming for hemodialysis in future, what advice could you give these patients?
yeah, the first thing I would advise the patient is that they should not be afraid of this dialysis thing. First thing, and second thing, they should follow whatever their nephrologist advise them. Strongly follow. I mean, strictly follow, because if you don't follow your nephrologist, you're gonna suffer anyways. I mean, it is very important. Like I had good experience in all my dialysis center, but when I came here, it was way better in the sense like we can discuss anything with you freely, and you are always here to give us suggestions and what can better us. If you remember, when I came here, I was having some stomach issue and my condition wasn't good. My HB level was down, and things got better quickly. But the main thing is that if your healthcare provider, your nephrologist supports you, and they make you feel like they are your friends, you feel very good about it. So the patients who are going to have dialysis, or they should not be afraid of dialysis. The main thing is this, because if they get afraid, they will get depressed, and whenever you get depression, your whole body reacts on that. So they should stay calm.
थैंक यू वेरी मच मुदब्बिर. आपने देखा ये एक पेशेंट हमारे पास काफ़ी टाइम से डायलिसिस के लिए आ रहे हैं, एंड ही इज़ वेल एजुकेटेड, एंड he well described all the things, all the challenges he is facing, and he is very much satisfied with our services. It also depends upon the care providing in different hemodialysis unit. So it depends upon all these things. So आप सब लोग जो डायलिसिस की तरफ जा रहे हैं या फ्यूचर में जिन्होंने डायलिसिस की तरफ आना है, तो ये सारे एक्सपीरियंसेस इन्होंने शेयर किए. जो चीज़ आपको एक बेहतर लाइफ की तरफ लेके जा रही है, वो मुदब्बिर साहब का यही कहना था, जो इनका एक्सपीरियंस है, कि आप अपने नेफ्रोलॉजिस्ट के साथ स्टिक रहें, आप अपने हेल्थ प्रोवाइडिंग टीम के साथ स्टिक रहें, ताकि वो आपको इस तरह की चीज़ें बता सकें. क्योंकि ये जो चीज़ है हेल्थ प्रोविज़न या एक स्पेशलिटी, वो एक बहुत डिफरेंट चीज़ होती है. वो आपको बहुत कुछ ऐसा बताएंगे, क्योंकि उनके बैकग्राउंड नॉलेज होता है, उनकी जो सारे एक्सपीरियंसेस होते हैं वो इन चीज़ों से गुज़रे हुए होते हैं. तो आप कुछ सोच रहे हैं, कुछ चीज़ कर रहे हैं अपने लिए, एज़ यू आर ऑन दी हीमोडायलिसिस, वो आप ठीक भी कर रहे होंगे, but it should be discussed with your nephrologist so that the things should be very perfect. यही उम्मीद करता हूँ आप सब लोगों से, और जो भी डायलिसिस की तरफ जा रहे हैं, ये कोई ऐसा काम नहीं है, ऐसी मोडिलिटी नहीं है, ये कोई एंड ऑफ लाइफ नहीं है. आप बहुत अच्छे कैंडिडेट हैं ट्रांसप्लांट के लिए. यू शुड गो फॉर द ट्रांसप्लांट. अनफॉर्चुनेटली इनका ट्रांसप्लांट ज़्यादा अरसा नहीं चल सका, बट द डेफिनेटिव ट्रीटमेंट, इफ़ यू आर अ यंग, then go for the renal transplant. Whether you are on hemodialysis या hemodialysis की तरफ जाना है या ट्रांसप्लांट की तरफ जाने के लिए, ये एक ब्रिज भी होता है कि जब तक ट्रांसप्लांट का प्रोसीजर चल रहा है, तो आपको बीच में ही हेमोडायलिसिस की ज़रूरत पड़ गई है, तो you should go for hemodialysis and then go for the renal transplant. So hope you got the point. Thank you very much.